asking you and for feedback and things like that. So once again, don't forget to *6 to mute yourself when you start talking, and *6 to mute yourself again. We're also going to be, there's a chat function available to you that you can utilize throughout the webinar. Robin is manning the station over there. So if you have questions to the whole group or questions that you just want to shoot to Robin and I throughout the webinar, please use the chat function. Okay. This webinar, I'm just going to go through the things that we're going to cover today in this hour that we have together. So we're going to introduce you to the FY16 Q Learning Collaborative for the local leadership groups. We're going to talk a little bit about the topic for this year, which we did discuss a little bit at the last meeting that we had together, that we were going to be focusing efforts around outreach this year. So we're going to talk a little bit more about what that means in terms of what we'll be doing for the Learning Collaborative. We're going to go over the model for improvement, the timeline that we have for the collaborative, the expectations that we have of different pieces that you'll be sharing and different pieces that are considered to be part of the deliverables. And we're going to talk about a small piece of collaborative pre-work that we're going to ask to complete prior to our being face-to-face in December. That we can hit the ground running with that small block of time that we have at that face-to-face meeting. We're going to go through the LLGQI requirements, some next steps and reminders of upcoming dates, and answer any questions that you have. Upfront questions before we get started. Okay, we will dive right in. So the collaborative topics, you're going to hear us talk about 3 different topics. The LLGs are actually focusing on one of those. The topics for this year were selected through a process that's been ongoing for about a year now, looking at home visiting data in the communities in which the LLGs work, and looking at the enrollment and retention and how programs are coming up to capacity in that home visiting data that the Home Visiting Initiative has. Looking at that data, one of the things that was noted is that we have a certain baseline for the requirements of the funding that's coming federally and at the state level to all of the teams across the state. In a lot of places, we're not quite meeting that benchmark. And what that means is we're actually leaving a lot of money on the table. We're having to give a lot of money back because slots aren't being filled. And we know that this is a gap because all of your communities had a needs assessment when this process first began. We know that the need is present in your communities. It's just a question of getting families connected to those slots that are available. And we don't want to leave them unfilled too long, because if we do that, then the funders see that as an indication that we don't actually need that level of funding, and they'll start pulling back a little bit, and we certainly don't want that to happen. So at the state level, we've had a lot of conversations between MPHI and the state and ECIC about how to approach this best across the home visiting LIAs as well as the LLGs. And where the decision kind of came down is that the LIAs, the home visiting model sites, are focusing on 2 different topic areas this year. They're focusing on enrollment or retention. So all of those teams have chosen to be in one of those projects for this year, and that's what they will be working on during the same time frame that you'll be working on your project. It was felt through discussions that the LLGs are really in a great position in the communities to work on the program outreach. So the community culture that's supportive of visiting, targeting outreach processes to the populations of need. There's capacity to support outreach within the communities. These all seemed like a good fit with the LLG teams. Now, there is somewhat of an overlap to a certain extent to some of the strategies that you'll see between your outreach here in the LLGs and teams from LIA side who are focusing on enrollment. So we would encourage you, if you have LIAs in your community who are focusing on enrollment, that you touch base with them on what it is that they've chosen for their project, because they started their process last week, so they know at this point what they are planning to focus on, and you'll want to make sure that you're not duplicating efforts if you do choose a strategy that is very closely related to enrollment. How were these change packages developed? So a lot of pre-work went into developing the change packages for the different topic areas. We looked at literature, we looked at input from the experts, both home visiting experts as well as the model experts and model developers on what strategies were known to be highly effective, what problems were known across home visiting. We also asked home visiting LIA program staff, so they were asked in their grantee meetings to provide some input as well on outreach, enrollment, and retention strategies that they use or they have challenges with. We also asked your teams, the LLG teams, in the last meeting to talk a little bit about the outreach strategies that you have in place and that you found to be successful, and that was taken into account as well. And very importantly, families were asked. This was an effort that occurred over the summer to have a few discussion groups with families who have home visit services to identify from their perspective what are effective strategies, what is maybe not so effective. So there were a lot of different sources that were used in kind of trying to winnow down what menu of particular change ideas would be within the change package. So turn to asking you all a question from your perspective and vantage point in LLC teams on which you serve. Why do you feel that the topic of outreach is important for focusing this year's QI Learning Collaborative? Robin is actually going to type these as we go. And once again, don't forget to press *6 to unmute yourselves to share an idea. I'd like to start off by sharing why they feel the topic of outreach is important.
Things, we think is pretty basic, and that is, you mentioned it earlier, we need to fill the slots, in order to serve families and to continue funding and to receive outcomes that we want from our program. So it's really just a basic need that we all have.
Mm-hmm. Absolutely.
What we're finding is it needs to be targeted outreach to the medical, the OB, and the GYN and the pediatric medical group. We're seeing a greater, we're just starting to see impact with that and seeing a greater willingness to at least consider home visiting when the referral comes from a clinic.
Mm-hmm.
Outreach, targeted outreach, have a greater impact than global community outreach in the near term.
Mm-hmm.
When we're looking at early childhood system building, we want other early childhood partners to value home visitation as maybe a first step, and then to having children in quality child care, and then hopefully better outcomes in school.
Yeah.
We also want other programs to understand what we're trying to do, and we want to avoid duplication and make sure we're maximizing our resources so that we can serve all the families that are in need.
Yeah.
This is Lisa up in District Health Department number 10. One of the parents here said that it's important that families know what's available to them.
This is Effie. I'm from Ingham County, and I want to say that it's important for outreach this year because, as someone spoke to earlier about program slots being filled, we want to ensure they're filled because we want to see these programs go on long term. We know that there are great outcomes of families when they utilize home visiting programs, and we also know that it also takes time for these things to kick in, and if funding is pulled, we won't be able to see those great outcomes, so we want to make sure that program slots are being filled with that in mind.
Good point, Effie. So these are all fantastic reasons on why it's important, and making sure that we're reaching those families who are most in need and that we continue to have that funding available and that capacity to reach them. And it's so important to make sure that all of the families in the community know what is available to them and that we're connecting to targeted partners who touch those families on a frequent basis. So these are all fantastic. Thank you all for sharing. So we're going to go into what is a QI Learning Collaborative. So this is a little bit of a different twist on what you've been doing for the last 2 years in terms of the QI Collaborative that we've done. So it's a little bit more structured in use of the change package. It's got some really nice features because a lot of the work has already been done in terms of, that root cause analysis and determining different strategies for your if-then. So that's a nice piece of that, and it's very structured in having learning sessions that alternate with action sessions. And what we are calling the learning sessions are those 4 meetings that you have that are LLG grantee meetings. There is a QI component in all of those. So that is what we are terming our QI learning sessions. So when you come together in December, in March, in June, in September, those will be the main learning sessions for this QI Learning Collaborative. So with a QI Learning Collaborative, it's a model that's used widely in healthcare settings right now to translate what's known about what works into practice. So considering that the what works is that change package that's been developed, it's being used on the rise in public health and home visiting settings, which is really good to see because it seems to be a model that is working well in this type of application. So we're excited to use it this year with both the LAs and the LLG side. The thing that's nice about it is that it brings you all together to share insights on the common challenges that you have as LLGs. So throughout the year, you'll be able to touch base with different communities around the state via this collaborative, those learning session meetings, share insights on those common challenges that you're having or strategies that you've done that have been really successful or tools that you've developed along the way that have been really successful. So it's a good kind of environment in which to share that knowledge at those learning sessions. So model itself starts with selection of a topic. So that piece was already done over the process of the last year, really intensely in the last probably 4 or 6 months, development of a clear, concise, evidence-based topic area. So the LLCs are focusing on outreach, but again, the LIAs are doing enrollment and retention. The second box you'll see there is gathering information from experts. Again, this is all into the change package in consulting with model experts, home visiting experts.
I may need you.
Visiting teams.
Oh, yeah. Here we go.
Background noise. So when if
No problem.
star 6 to mute yourself. That seems better. Please remember to press star 6 to mute yourself so that everyone is able to hear. So again, that second box is gathering information from the experts. That leads into that first circle there, which is development of the change package and the planning for the learning session 1 that you're going to have in December. So the change package right now for outreach is nearly finalized, and you can see the final version at that meeting in December when we start the kickoff for the projects. Second circle there that you see kind of hovering above that participants is kind of your piece before we get to the learning session 1. I'm going to ask you to do a little bit of work that you've already done last meeting. I need you to think about what you're doing in terms of outreach in your communities, but we're going to ask you to actually do a process map around your outreach. Next, we have, so that's where we are right now. We're doing this webinar to kind of introduce change package idea and concept and how this aligns with what you've been doing all along and kind of fits in well with that and where it's a little bit different. And we're looking at this work phase here between now and that December 14th period. That is that circle hovering above with participants in it. The very next thing that we'll move into in the Learning Collaborative is that Learning Session 1, which is going to be at that December meeting that you have in Lansing that Bryn set. Between Learning Session 1 and Learning Session 2, we have what's termed an action period. So lots of you are going to recognize that little circle with the arrows.
She muted herself.
I think so.
That's my guess as to what's happened.
Hear me?
Yeah, I can hear now, but you cut out.
Oh, when did I cut out?
I was talking about the action period.
And so repeat that again.
About the action period?
Okay, good. Okay. Can we now? Okay, well, if you're still experiencing problems hearing me, just put it in the chat function and let Robin know. I'm not quite certain why that would happen, but if it happens again, just let us know. So in between each of the learning sessions is an action period. These are the points at which you're going to be actively working on your PDSA cycles. And one thing that I said that I think I cut out during I said it is that note that there's 4 PDSA cycle icons there. That is not to say that we're asking you to go through 4 complete PDSA cycles. It's just to indicate that you're ongoing basis working on that PDSA cycle in between the learning sessions. We actually anticipate that most of you will be doing 2 to 3 over the course of the next 10 months. So the same pattern after that, we have a learning session where we come back together and learn from one another and share where you're at during the project, and then another action period, and then another learning session and action period. And once we complete the 4 learning session sequence, you will have completed your project for the year and move into that final box, which is sustaining the gains, which is this as you would have done in of the previous years with the QI cycle. So this is, you'll note, very similar to the model for improvement that we've used before, and there are pieces of the model for improvement that are overlaid in here that I'm going to go over in a second. The overall learning session action period thing is the same thing that you have been doing in previous years. We're just putting it down on paper, just as a very clear outline of have a session where you learn from one another, and then you're going to go back to your communities and you're going to be actively working between sessions on those PDSA cycle, where you are in that PDSA cycle. What's different is that the change package has its own measurement system. So whereas before, in previous years' projects, we kind of let you determine your own measurements that you were using and different processes that you were process and outcome measures that you were using, and then there was one collaborative level one. This time out, it's a little more prescriptive, and we'll be sharing more about that in the time to come. I'm still getting a lot of background noise. If someone has please take the time now to press star 6. And
can you hear me? Can you hear me? Hear me?
Yes.
Okay. You know what? I'm muting my phone, and I did star 6. The pin is not working. I'll do 6 again. On the phone, I just do star 6. Is that what you're saying? On my phone?
Just work from cell phone, yeah.
Different?
If you're calling from a cell phone, you probably also have a mute button that you could take advantage of.
I did, and I thought I had muted. I really did. Okay. You can still hear me, right?
Yeah.
Okay. Well, oh. Okay.
We'll keep trying, and we'll keep going forward. Again, the change package is different in that it comes with a measurement system. So you'll be receiving from us actually an Excel spreadsheet of different measurements that can be used for this particular learning collaborative. There's also a little bit of pre-work in that we're asking you to do your process map a little bit before we get to the meeting. And this is so that you can hit the ground running. Certainly, if you have questions while you're developing your process maps between now and that December meeting, Robin and I are absolutely available to you for consultation. Another difference is that we're asking you to complete more than one improvement cycle. So as I said, we're not anticipating that you will do 4 mini cycles. We're thinking maybe 2 to 3 that are all in the service of one bigger project. So you're still having one thing that you're focusing on. You're just taking small tests within that. So I'm sorry, teacher. Okay. I forgot to mention down at the bottom, you'll see the supports there are nearly identical to what we've done in the past. I will be available via email, phone. We'll be sending out updates. What's different is we'll be checking in with you on a more frequent basis. So because there are shared measures, we're going to do monthly data tracking. So we'll talk a little bit later about a monthly due date for the specific measures that we're asking. And then after we receive that data from you, we're going to turn around and give monthly updates to you about each of the teams are in achieving those different levels. Okay, next is the model for improvements, which is something that we have covered before in the PDSA cycle. Again, it is embedded throughout the QI Learning Collaborative structure that we're doing this year. And if you'll remember, the 3 quick key questions questions there. We're trying to accomplish how will we know that change is an improvement, and what changes can we make that will result in improvement. And it's that same plan, do, study, act, continuous cycle there. Where this interfaces with the QI Learning Collaborative structure that we have this year and the change package is that what are we trying to accomplish has really been answered by the topic selection and in setting an aim. So we have, when you see the change package, we have a shared collaborative aim, but you will also be setting your own individual process aims within that. Second question, how no changes and improvement. The measurement strategy is embedded in the change package. So we're going to be regularly collecting data and measuring progress, outcomes, but also process and some balancing measures as well. And then the last one is what change can we make that can result in improvement? This is really the core of the change package. So the root cause analysis that you would have done is really already present in the primary and secondary drivers that you'll see. And change ideas are really, those strategies that you would have identified through an affinity diagram that can be turned into your SM statements. The key changes that can be made to result in improvement. This fits into the learning collaborative model. Over the course of the learning sessions, we'll be focusing on different things when we're meeting together. So learning session 1, we're really going to introduce that finalized change package, discuss that measurement strategy, how we're going to go about it, share the tools that we've developed for you to easily track and measure, or track and graph your data that you're sending us. Talk about team meetings and start filling out your team charter and planning for your action periods. And then you're going to report out at the end of that learning session 1 in December on what your initial plans are for action periods with the other teams. So there will be some team sharing there. In session 2, we're going to talk a little bit more about ideas, think about the methods that have been used, what are some barriers that people have encountered, assess progress of the collaborative as a whole, and the use of the change package as well as the measurement strategies. And then we're going to put aside some time for teams to talk about your stories and, again, share the experiences that you've had. And talk about the measurement piece that you have and any issues that you're encountering and how we can help to clear those up. The same sort of thing will happen for learning session 3, and then learning session 4 is really, it's our celebration, just as we've done in previous years. You'll share your finalized project stories with your results, and then we'll talk a little bit about how you're going to hold your gains and spread that improvement. Again, the action periods will have monthly data reporting, and then there'll be monthly PDSA cycle reporting. So you'll be letting us know where you're at in your PDSA cycle very briefly. So we have the PDSA cycle, which will be very familiar to many of you. The plan, do, study, and act section of this cycle. Just to quickly review, the plan stage is the stage in which you spend the most time. You're trying to figure out what is your objective for this particular cycle of this PDSA. What are your questions that you can answer by this cycle, and what does the team predict will happen? What is your improvement theory? You're going to determine that here in your plan. You're going to plan to carry out the cycle. Who's going to do what, where, and when? You're going to plan for data collection. Who's going to collect it? What type of data you're going to collect? How you get a hold of that, and when that's going to happen. And then move into the do, which is actually testing those improvement theories that you have. The emphasis is that the change should be really small. So you're biting off very tiny things this year during each of your PDSA cycles. We're going to show an example in the next slide, I believe, of what this looks like in terms of very small steps that can be taken in the service of one greater strategy over the course of the project life. In the do, you're also going to document your problems, unexpected observations. As we've talked about before, this comes in very handy when you get to the study stage and interpreting your results. also throughout the due, we're also going to be collecting data. And again, we're going to do monthly data collection. During study, you're going to complete your analysis of the data, compare what that tells you against what you predicted in that plan stage, and summarize what you've learned. And then finally have the ACT portion, which is kind of closing out that PDSA cycle, determining if you're going to adapt, adopt, or abandon that particular idea that you were testing. And then you're going to move on to determine what you're going to do in the next cycle. So is a change package. Specifically, the components here are, we have a SMART aim statement, which we've had before. This won't look different to you. It's the goal everyone is going towards in the Learning Collaborative. We have change concepts, which are the primary drivers, common strategies that can be put in place to address that root cause, that problem. We have key changes, which drills down a little bit more into secondary drivers that lead into that primary driver. So specific areas within change concepts where you can make small changes to address that root cause. Have the specific changes, which you'll see are the most populous on the right-hand side of the change package, that are just a list of specific improvement theories that could be implemented to work towards improvement. So there is a laid out menu of ideas of things that you could test. And again, with this particular change package learning collaborative strategy, we have measurements built in. So you'll have specific measures that all of you will be collecting and reviewing on a monthly basis to determine the impact of PDSA cycles. So what does it look like? What we have here is actually the enrollment key driver diagram of a change package for the LEs who are working in that enrollment collaborative. So this is the one that they are actively using right now. So you'll see on the left is that SMART aim, and the next column over are those primary drivers. The middle kind of grouping of those colorful boxes are what we're calling secondary drivers, and then over on the right are those specific ideas for change. So those specific changes that you're going to select from to test during your PDSA cycle. So next we're going to quickly walk through an example here. So looking back at those 3 key questions from the model for improvement, what are you trying to accomplish? How will you know that change is an improvement? And what changes can you make that will result in improvement? These are kind of grouped into those questions. So the topic that you're all focusing on and we're using for this example is home visiting program outreach. There's an aim that's been set. So by September 1st, 2016, in this example, Sunny County LLG will increase the number of active referral sources from 12 to 20. So they've been very clear about what they are trying to accomplish. The next piece is how the changes improvement. That is measurement strategy. So in this particular example, they're focusing on the number of active referral sources as defined as at least 1 referral in a 3-month period coming from that source. Finally, that third question, what changes can they make that result in improvement? They pulled out a primary driver of capacity and support for outreach, a secondary driver of maintenance of a robust network of referral sources, and then the key change that's picked from that menu along the right is establish regularly occurring weekly, monthly mail and phone follow-up with referral sources. Their key thing that they are testing is regularly touching base with all of those referral sources. Something to note with the change package here is that each of you will be selecting your own primary and secondary driver of focus, as well as the specific change strategy that will be tested. So that's kind of a new thing this year with the change package. Again, the measurement strategy is going to be across all the teams, and at that first meeting we have together, we'll be walking through what the measurement tool looks like and how we will be implementing that. Just to continue this example, this is how it looks laid out in that Plan, Do, Study, Act phase. So walk through this, you'll see that, they had their topic selection around program outreach. They set their aim. Measurement strategy was around referral sources. All the things that we talked about in the previous slide. This slide here talks about how they specifically did that. So in the first box in the upper right, what they did in the plan was the LLG outreach. They decided that the LLG outreach lead would follow up with referral sources during the last week of each month via phone and email. So that was their specific thing that they decided they wanted to try. So then went into their due stage, and the outreach lead made contact actively via phone and email, trying to get in contact with its referral sources, and actually got in contact with 10 of the 15 referral sources that they had on their list over the course of the 2 months that they had allotted for their timeline for the due, which resulted in a total of 10 contacts. Then they went into the study phase. So they looked at the fact that 10 referral sources responded to contacts, but noted that 5 sources consistently did not respond. So it was the same sources that they just weren't able to get in contact with regularly. So what they decided when they moved into ACT was that the process change showed some success. They liked some of the things that they saw were happening with doing contacts with those referral sources. However, they're still concerned about the engagement of those 5 non-responsive sources. So they're going to think about what we're going to do around that in the next cycle. So, an important concept to take away from this is testing small cycles leads to improvement and builds towards implementation. So don't feel overwhelmed, because you are really going to bite off very small things. And this is an example on this slide of how that might look in reality for you. So the aim that is here is that by September 1st, LLGs will increase the number of referrals to home visiting programs that are low income, because that is a target population of a lot of our LIAs. At the bottom of the slide, the change that they chose to focus on, so that key idea for improvement from the right-hand boxes on the key driver diagram, they drilled in on one bullet in there to use parent cafes to assess and communicate benefits on an ongoing basis. Their first cycle, they ended up going through 3 cycles. So you'll see 3 boxes here. In the first cycle, you'll note that they just did a small thing. They revised their protocol for parent cafe recruitment. And as part of that, they asked a few parents about, what changes they might want to make within that. So they then revised their protocol and tested that revised protocol on a small basis in 4 zip codes through March. Then in March, they closed out that original PDSA. They learned some things. So in the next cycle, they decided, okay, this cycle we're actually going to work on further revising that protocol. It didn't quite get the engagement that we wanted, so let's revise it just a little bit further and think a little bit more about the materials that we're sharing. And then they made those revisions. They tested those at parent cafes April through June in the same 4 codes that they did the first cycle in. So they're still sticking to a pretty small test. And then our last cycle during this 10-month period, through August, they made a revision to the process for feedback on perceived benefit of services. So coming out of cycle 2, they were getting the engagement that they wanted, but they realized that they weren't getting all of the information that they wanted. I'm so sorry. That they weren't getting all of the information that they wanted. Really, they wanted to focus that final cycle that they had in this year on getting, improving their process for getting feedback from parents. They did that, and then they tested their change to that feedback process in their parent cafes that they were holding April through August. So you see, in all 3 of those, they took small steps working towards that one big aim of increasing the number of referrals, but focusing in on a change that they actually split out over 3 different cycles. some examples. I know we're getting close to our time here, so let's quickly go through the QI Learning Collaborative timeline for the next 10 months. So right now we're in that first yellow dot, the webinar where we're talking about what a change package is. That first big arrow is the pre-work that we're asking you to do between now and that December 14th meeting. So we're asking you to, as teams, to map the current outreach process that you have prior to getting to that Learning Collaborative session number 1 in December. Then we have the December followed by an action period. And see the box above that denotes what's occurring in the action period. Is you're completing PDSA cycles, you're doing monthly data reporting. It's the same thing for action periods 2 and 3. And see along the bottom where the learning sessions fall in there. So December, March, June, and then your final learning sessions fall into that, in between those action periods. Expectations from MPHI, ECIC, and the state. What we have done with MPHI, the state, and ECIC's input is developing some technical content, putting these change packages together, and measurement strategies, but we could not have done this without your input, without the family's input, without the home visiting LIA's input. All of that was so important to developing these and putting us into a position where we have pretty great change packages. We're planning learning sessions to make sure that you get the most out of them between MPHI, ECIC, and the state. So you're going to have updates from all of us as we roll through the year through those 4 in-person meetings. I'm going to be reviewing monthly data and reporting. So there should be a monthly data due date to us using the tool that we're going to roll out to you in December, and be providing collaborative summaries monthly to all of you so that you can see progress of the collaborative as a whole as we roll through this, which I think is a really nice thing. It's something that we haven't done with your groups before. The LIAs, to a certain extent, have this on a quarterly basis with feedback on their site level data, but it's not something that the LLGs have had before. So we're pretty excited to be able to do that this year. And then all three of these groups are going to be providing support to you during action periods. MPHI will provide guidance and coaching on the QI piece. ECIC is always there for LLG support piece, and MDHHS is always there for any contractual things that you may be encountering. So some expectations that we have of you. We just talked about expectations of what you can expect from us, but what do we expect from you? We expect that you'll attend and participate in all 4 of the learning sessions. And again, those learning sessions are embedded within your LLG quarterly grantee meetings that ECIC is setting up. So there will always be a block of time on the agenda that is devoted to this piece and this QI work. We're asking that you're completing the action periods, so those 3 action periods, and that you complete 2 to 3 small PDSA cycles within those. So you're actively working between each of those 4 meetings, and you're working fully through 2 to 3 small PDSA cycles over the next 10 months. We expect that you'll participate in ongoing data collection and updates, that we'll do monthly data submission on your collaborative's measures. Data will be due on the 15th of each month, reflecting what occurred in the previous month. Then you're going to also be providing monthly updates on the team's progress. These are going to be really brief and will be due with the data that you're submitting as well on the 15th of each month. We're going to ask of you that you actually review the monthly collaborative updates. So really look at, where your team is, what other teams are. This might be a good point. If your team is not having the gains that other teams are, maybe touching base with other teams to ask, what they're implementing, what they're doing, that might provide some insight. We promise to you that we will send those out no later than the 30th of the month. But of course, we need you to submit by the 15th in order for us to be able to turn around. We also expect and really encourage that you'll reach out for support and guidance and coaching as needed from MPHI and ECIC in the state. And MPHI is here to really help with the CQI piece. Any questions that you might have, any challenges that you might be experiencing with some of the tools or strategies that you're implementing. The work. So we've talked about this a little bit as we've gone through the presentation today. What are we asking of you between now and December? So just briefly, we're asking you to develop a map of your current process. What is the current outreach process that's in need for improvement in your community? We're asking that you discuss that current outreach process as a team and make notes of any observations you have of spots where there might be gaps or inefficiencies or really clear places for improvement in that process. And we're asking that you bring your completed outreach process map and notes to that first learning session in December, because that's really going to be the basis for the next step that you will be taking there. I'm going to pause just very briefly and ask, are there any specific questions right now? I know we're running a little bit short on time.
This is Rita in Wayne County. Because we have several active members, Gaylada had to trim our attendee list. And my question to you is there a way to get this change package prior to the 14th so that those of us who won't be in attendance for whatever reason can be looking at it before we collectively walk into the learning session?
Unfortunately, we can't. So the first date that it will be rolled out is at that December meeting, because we really need to walk through it with teams and deeply explain it, because what we really don't want is for a team to be so excited and grab a hold of it and run and bite off more than you can chew or anything like that. So we're holding off. We're also holding off because we need approval on the final version from the state. So it's not quite yet. It'll be rolled at the meeting. So just to quickly move through the last few slides here, the QI requirements is that you actively conduct CQI, that you participate in the CQI Learning Collaborative as part of the requirements that you have. You're conducting regular internal CQI meetings, that you're submitting the CQI work that's listed there, and you're participating in those grantee meetings with that QI component. And I have dates there, but they also came out from Bryn in August, and additional information as you get closer to those meeting dates will be coming from Bryn Fortune at ECIC. So support from MPHI. What we're going to do this year that's a little bit different is we're going to comprehensively review your CQI documentation and provide feedback on first complete draft. We won't be doing additional reviews unless you request them. So we're going to deeply review that first draft that you send us, and then after that, it's just if you would like us to review, we will review those documents for you. Doing the monthly data and project updates and PDSA cycle summaries. We'll be providing ongoing guidance and coaching via email and phone, and we're always here. Please reach out to us. That's what we're here for. Next steps and reminders in this last couple of minutes that we have. Again, complete that CQI Learning Collaborative pre-work on process mapping and having that discussion with your team about the process and any observations that you have. And you can also note now on your calendars those monthly data and project update due dates, just so that they're there and ready to remind you throughout the year. The LLG grantee meeting is coming up on December 14th. Again, the details come from ECIC and Bryn Fortune. That will be taking place here in Lansing. Bryn if you're still on, is there anything you would like to say or announce about that upcoming meeting?
The LLG staff leads should have earlier this week received a registration link to register their team, and in that it had all the information they would need about the logistics and location for their team, as well as all the upcoming meeting dates for the rest of this fiscal year.
Fantastic. Great. Okay. Well, we are just about at time. Are there any additional questions from anyone out there? Well, with that, we are at time, and I want to deeply thank you for joining us today so that we could get rolling on this. You see on the last slide is my contact information. I will, and the LLGQI advisor. Robin is our Grand Michigan Home Visiting Initiative CQI Plan Coordinator. Please feel free to contact us. We, again, recorded this webinar, and we'll be posting that to SharePoint and sending out the link. We also will be sending out the slides to you. And once again, thank you, and we hope that you all have a lovely afternoon.
Hi, Brenda.
Thank you.
All right.